Okay, so before we begin CPR, the first thing that we need to do is remember to complete that primary survey. Remembering Dr. ABC, danger, response, airway, breathing and circulation. So before we begin any CPR, the first thing we need to do is check the environment for danger, make sure we're clear of any hazards, make sure we keep ourselves safe, but also the casualty as well. Once we've checked for danger, we make sure the area is safe, we need to call for some help because we might need an AED when we're going to check for breathing. So the first thing we're going to do is just kneel down next to the person and check for a response. So we're just going to gently place our hands on the shoulders, shake the person and ask, hello, can you hear me? Hello, can you hear me? Okay, checking for a response. If we don't hear a response, the next thing we need to do is check the airway. So we just check in the mouth, checking the nose, looking into the ears, just making sure that everything's looking okay. And again, if that airway is obstructed. Once we've checked the airway, the next thing we need to do is check for breathing. So we're just going to place the hand onto the head, take 2 fingers under the chin, tilt the head back to open that airway, and we're just going to look down the chest for 10 seconds. Okay, when we're checking for breathing, if the casualty is not breathing, we've asked for help, so we're going to ask that person to go and grab us an AED or find the nearest defib and call 999 and inform them that we have a casualty not breathing. As this casualty is not breathing, we need to perform and complete compressions, so we're just going to take our hands, interlock those fingers, keep the heel of the hand nice and high, and place into the midline of the chest, keeping the arms straight, and we're just going to complete 30 chest compressions. Okay, remembering to push at a rate of 100 to 120 beats per minute. Once we've done 30 chest compressions, we then complete 2 rescue breaths. Hands onto the chin, tilt the head back, pinch the nose to create a seal, and 2 sharp breaths. Once we've done that, go back to the compressions and continue CPR until we get the defib arriving or the paramedics tell us to stop.